Hey, I'm Dr. Brian McKay of Core Health in Darien, and I'd like to speak to you today about what could be a boring subject for most people, but back pain. As a chiropractor, we do a lot of physical therapy here as well. There's a PT on staff, massage therapist. So we're intimately familiar with lower back pain. Now, back pain, 4 out of 5 people are going to get it, so you're not immune to it. I think it's a part of the amount of sitting we do. People sit down when they get on the train. People sit down, well, not right now with the coronavirus going on, but people sit way too much. You sit down to go to work. You sit down when you're at work. You sit down on your way to work. You sit down when you get home. You may even sit down on the Peloton, for all I know. But there's a lot of sitting. And so mechanically, most people, the core is not strong enough. We don't do enough core exercises by a long shot. So what I want to encourage you to think about is you have to look at the mechanical wonder of the low back. There's not a lot of muscles down there in the low part of your back, so you really need the core muscles in the front to help support the lower back, because most of the pain you're going to feel is going to be in the back, but a lot of it is from a weak core. So when your low back acts up, um, why would you go see a chiropractor or over a physical therapist? Quite honestly, I think you should see both, which is what we do here at Core Health. But that's a kind of a shameless plug. But the idea here is you have a muscle, you have a nerve, you have a bone, you got ligaments and cartilage as far as the disc. So typically, mechanically, well, I find a lot of lower back issues come about from instability in the pelvis. Your pelvis is made up of the two ilia, or the ilium is one ilia, plural for Latin, and the sacrum. And when those are working together and moving properly in conjunction with each other, you have a pretty stable way to support the lower back. Now, for whatever fault, I mean, you could have an accident, a car accident, could be a lot of different things going on with, that would cause instability. But, typically I think, poor posture is one thing, but sitting is the major component here. But maybe you had a fall or an accident. Maybe you golf a certain way and you're torquing your pelvis out. So there's a lot of different reasons as to why you're going to have it, but chances are it comes about from lack of flexibility, which we can all do a better job of stretching and staying mobile. But also there is the inherent ability for things to wear out. And what you have to try to consider is the low back is the mechanical U, and the mechanical U is a wonderful marvel of engineering, as long as everything's in the right spot. Now, when the vertebra go out of place, I think like the lumbar vertebra, typically when you're going to get an MRI and you have a chronic low back pain, what will happen is you have instability in the pelvis that leads to these herniations or bulges that pretty much show up on MRI. So in order to avoid that, that's where the chiropractor comes in, is mechanically resetting the pelvis. Resetting the pelvis, putting it so that it's moving properly. Because pain is your concern. Obviously, it's everyone's concern when they walk through the door. But what really, really happens is you have to have the ability for these bones to move properly in conjunction with each other. So you got the brain on the top of the food chain. The brain tells the muscles to move the bones, and as long as that chain is uninterrupted, you're okay. Now, when the input coming in from a muscle is askew, you get your output from the brain to the muscle to the bone will get skewed as well. So sometimes you have what I call compensations. You have a people aren't really aware of it, but it's a major muscle called the iliopsoas as well as the iliacus. These are trunk flexors. So you would, if you were doing a crunch, an ab crunch, you'd be activating the trunk flexors, the iliopsoas and iliacus. And I have found on almost every acute case, not everyone, but many acute cases, have a unilateral spasm in the psoas or the iliacus. And my belief is that this comes from instability. So the body does is the brain actually takes over and says, okay, we're going to stabilize this as best we can. We have instability, which is leading to your pain potentially. But by tightening up the muscle on one side, you're stabilizing it. It's downgrading it, but it's stabilizing it so that there's less pain in the body. You're not going to go to a certain position that will cause or aggravate the problem. Now, if you're in really, really bad shape, and we don't see it that often, you can have someone doubled over in pain. And when they're doubled over in pain, that's when you have bilateral psoas and iliacus spasm. And that's really to prevent a lot of damage. So, you can work all kinds of wonders on getting people out of pain, but you do need to address the muscular component, which is what any good physical therapist or a competent chiropractor is going to do as well. So the brain is really what's controlling everything. The brain is where you feel all pain. I mean, if you have a bad knee, sure, you're going to have localized pain to the knee in your mind, but the brain is where it's all felt or it's all controlled. So the instability in the pelvis is a much bigger problem than I think most people realize. Maybe you cross one leg over the other constantly. Maybe you drive a manual car or a truck where you're relying on one leg most of the time as opposed to the other. But sitting being the biggest culprit. And then inactivity of the muscles. So the mechanical aspect of the spine is really what a chiropractor is going to address. Now, when the bone misaligns, we call it a subluxation. And I don't really think you give a damn about the subluxation, but you care more about the pain. So when someone comes in, they're in a lot of pain. Yeah, we're going to address your pain, but we have to take a look at the muscles involved and address the muscles involved. We're going to take a look at the structure as a whole, because you could have a bad femur causing your hip to have issues, which then leads to instability in the pelvis. So you really got to take a look at the whole unit. Really kind of from the core muscles down to really come about with a true healing of the underlying issue. So when you go to you go get your MRI and it comes back that you have a bulging disc, the tendency is to focus on the bulging disc, which, listen, it is what it is, but you have to remove the offending mechanical breakdown. So by repositioning the vertebra to a better location, you'll restore normal mobility, because lack of mobility is one of the hallmarks of pain. If you have a serious loss of mobility, at some point in time, pain is going to ensue. Now, you could definitely take a Advil or Aleve. Some people go for shots, cortisone shots, but you're kind of not hitting the nail on the head. You have to take a look at the mechanical part. And the best way to take a look at the mechanical part is to really, I use applied kinesiology. So say your pelvis on the right side I always tell people, look at it as a clock face. If I push on it at 12 o'clock or 3 o'clock or counterclockwise, clockwise, all these different positions, if the ilia is out at that point, so say I'm pushing on the ilia in a 2 o'clock fashion, as if it was a clock face. Now, if that causes a breakdown in the normal neural loop, what that tells me is that that's the direction that the ilia is out in. So if I'm pushing up at 12 o'clock noon and it goes weak, well, I know I have to reverse that out to connect the normal neural loop and give the brain the information that it needs. So applied kinesiology is a really, really cool way of identifying where the bones are out of place and then correcting it and demonstrating strength gain. We are going to address your pain, and we're going to do a really good job of addressing your pain, but it works with the body more intuitively. So it's kind of like I'm asking the body. So I can go and poke around and get a feel for it. I can look at x-rays, I can look at MRIs. But what I really like to do is ask the body. And we do this procedure called applied kinesiology, where we actually touch the spots and find out where the brain is telling us that the problem really lies. And sometimes you can have a low back pain on the right caused by something on the left, and vice versa as well. But when you do have a low back issue, okay, and I'm talking about chronic low back pain. A full approach where home exercises are crucial. I mean, do you really want to come and pay for a visit where there's certain exercises you could be doing at home to help, to help yourself? I think most people do want to do that. And in a sense, it's a partnership that we form. I'm going to find where the problem is, in my estimation, by asking your body through applied kinesiology. And it's a very helpful way, but it's also reproducible. And it's something I can show patients how they can test themselves to see where these problems come about. So the approach I like to take is one where applied kinesiology, asking the brain where the issue is, not just, and the exam is going to be a regular orthopedic exam, neurological checkup as well, and there's some palpation. But by asking the body using a muscle strength test, I'm able to identify the problem areas and work on those areas specifically. And like peeling away a layer of an onion at a time, it helps me get down to where I really need to focus. So applied kinesiology helps identify where the structural issues really are. And by fixing these structural issues and then coming up with a home exercise program, and a stretching program as well, we're able to really get to the root cause of most low back cases. I'm Dr. Brian McKay at Core Health. I enjoy educating people, but I also enjoy helping people get out of pain and then working with them, not just doing it on them. It's a little bit more rewarding to have a person understand what it is you're looking to accomplish. So when you have a back problem, if you have an issue, give me a call, 203-656-3636, 203-656-3636. Look, and I'll answer any question you want. You want to come in for a consultation. We never charge for a consultation because, quite honestly, we don't know if we can help you. So it really takes a little bit of time to figure that out. All right. Hope you're having a good day. I hope you learned a little bit about applied kinesiology, how it relates to the structure, and how we can help use applied kinesiology to identify where the main problems are and to correct them and get you out of pain. Thanks a lot. Have a great day.